Hi, good morning Jackson. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 12th of April 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Jackson Rolfe.
And what is your candidate number, please?
My candidate number is 245289192.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can go in helping make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What are your professional goals?
I have several professional goals. A few important and most achievable professional goals shortly are joining the Emergency Nurses Association and becoming an emergency room nurse practitioner. The second is to earn my master's in nursing. I love teaching, and also, I would like to guide young aspirants to become successful nurses and have excellent careers. Thus, I hope to mentor nurses and share what I have learned. I am excited about the opportunity to fulfill my goals.
Do you like working with a team?
I thrive while working as a part of a team because of my ability to adapt. Working on a team allows for the best outcomes for patients. Everyone has a different way of looking at a problem, and multiple perspectives can bring about creative solutions. Also, working on a team motivates me because I enjoy celebrating the successes of others. However, I feel confident in my ability to work alone as well.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
I find the best way to handle the stress of being a nurse is through meticulous organization and attention to detail, by making lists and prioritizing what needs to get done throughout my day. I find that tasks which might seem overwhelming all at once are much more manageable. This also makes it possible for me to stay calm and remain focused on what needs to get done when unexpected situations arise.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, that's fine.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. I am Jackson Rolfe, your attending nurse here today. Can you please tell me your full name, for the records?
My name is Mihiraa.
How may I help you today, Mihiraa?
I'm in trouble, nurse. I need your help.
Oh, don't worry, Mihiraa. We are here to help you. Kindly feel free to vent your feelings.
I have been diagnosed with type 2 diabetes recently, and I am on Metformin medication. But I am having difficulties taking them.
I am sorry to hear that. Well, Mihiraa, could you please tell me in detail about the side effects you are experiencing?
Yes, I will. I am having several side effects due to this medicine. My stomach is upset, and I have stomach pain more often. Beyond that, I have a metallic taste. I am considering stopping the medications.
I understand how much it is troubling you. It is true, Mihiraa, there are some side effects of Metformin in certain patients. However, I can assure you that these are common side effects that usually go away over time. But considering stopping the medication is not good for your health.
How much do I need to suffer?
Yes, Mihiraa. Your question is understandable. For your clarity, let me tell you the importance of Metformin compliance.
Okay. You may please.
Metformin is a medication that helps lower blood sugar levels in people with type 2 diabetes like you. If you are not taking the Metformin, then you will get uncontrolled or poorly controlled diabetes, which can cause progressive damage to blood vessels, nerves, and organs. You will also develop some of the complications like high blood pressure, narrowing of the arteries of the heart and brain, and stroke, which all lead to severe health issues.
Then, what should I do now?
Don't be hopeless, Mihiraa. As I said, these side effects will subside soon. Moving on, let us discuss better ways to deal with it.
All right, nurse.
You can reduce them by taking Metformin with a meal. Taking the medication on an empty stomach can make your symptoms worse. Food can help reduce nausea, vomiting, diarrhea, and abdominal pain. Moreover, drink enough water to stay well hydrated. Dehydration can worsen the side effects of Metformin and increase other risks as well.
All right, nurse. I will, but any remedies to get rid of Metformin?
Your thought is natural. Managing your diabetes is the best way to avoid taking medication. Managing type 2 diabetes involves healthy eating. Eating a balanced diet that is low in added sugars, saturated fats, and salt can help you control your blood glucose levels. You should avoid sugar-sweetened beverages and alcohol, as they can raise your blood glucose levels quickly.
Oh, I see.
Next, do exercise regularly. Physical activity can help you regulate your insulin levels. Additionally, you need better stress management. Stress can affect your blood glucose levels and make it harder to manage your diabetes.
Okay. I will take care of it.
That's great, Mihiraa. Also, checking your blood glucose levels on a regular basis can help you see how food, exercise, medication, and other factors affect your blood glucose levels. This can help you adjust your diabetes management plan accordingly.
I got it. And nurse, will it affect my vision? I heard that.
What you heard is correct. Vision impairment is a common complication of diabetes. It can affect people with type 1, type 2, or gestational diabetes. The longer you have diabetes, the more likely you are to develop it. The risk of developing diabetic-related vision problems can increase due to poor control of your blood sugar level.
All right. May I know the difference between type 1 and type 2 diabetes?
Of course, the difference between type 1 and type 2 diabetes is that type 1 diabetes is a genetic condition that often shows up early in life. Type 2 is mainly lifestyle-related and develops over time.
Okay, nurse. Thank you.
Mihiraa, do you have any further questions?
No, nurse. I will follow as you said.
That's great. Mihiraa, I hope my explanations are clear to you. and always feel free to contact us for further information.
Sure, nurse. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.